So today we will be tackling, later on, we will be tackling the AMC a little bit, especially for those who just finished AMC 1. You would not know too much about AMC Clinicals or what you are diving into. So we'll be tapping on that. Then we will move on into booking, which is happening tomorrow in the morning. So we'll dive into booking a little bit, reading the instructions, seeing how it's done. And then we'll wrap it off with a couple of resources that you can use for the AMC exam, AMC 2 clinical exams. So if there's anything you want me to address in the middle, you can put in the chat box and I'll try to squeeze it in while I'm doing the session. Mute. All right, we're talking about prompt timer. Okay, I'll note that down, and then later on when I'm doing the exam portion of things, then I'll include the prompt timer part of it. Okay. But yes, since we are a bit free, but every station has a prompt timer in the AMC Clinicals exam, and it depends, right? It really depends if the question comes in with saying that, oh, take history for no more than 5 minutes. It means when the 5-minute prompt timer bell rings, then you're not allowed to take any more history. However, if the station just says that this station has a 5-minute prompt timer or 6-minute prompt timer, then that just means that there's a 6-minute prompt timer. Ideally you should be moving on from task 1 to 2 or task 2 to 3, but it's really up to you, right? If you tend task number, you're a faster role player, if you're a faster doctor, you finish task number 1 a bit more quickly, then you would move on to task number 2 slightly earlier. It's really okay. But ideally, after all the pilot testing that has been done with these cases, this is the rough time frame that AMC has allocated to the different tasks. Doesn't mean that some doctors take a little bit longer, some doctors take a little bit shorter, but try to follow it as much as possible. Okay. But it's always there in every single station. So don't worry. Even in your physical exam stations, you do have and majority of the stations, in fact, so far, I've only heard stations only have one prompt timer in every station. So not to worry. And to be very honest with you, I know that when we are role playing, a lot of doctors do worry about time management. But in the real exam, time management wouldn't be too tricky because the task is very specific with regards to what they want from you in that particular station. So when you're addressing the different tasks, you realize that, hey, it's actually manageable in 8 minutes. Any other questions? Keep them coming. Okay, I'll ask that in a bit. All right, so the question asked was, can you see the OSCE question in the room? Yes, you can. So you are allowed to actually see the station in the room. So it's quite. So outside you see the stem. Inside you also see the stem in your station. All right, as we're waiting for a couple more minutes, I decided to try something a little bit new. Okay, resources. Dr. Venkatasai, we will be tapping resources towards the end of the session today, so stay till the end. Now, before we start a little bit, I tried something new because I saw something on TikTok, right? And I wanted to try it with you guys. So just before I start the session, there's 2 little cute questions that I want to ask you guys, okay, while we're still waiting for the rest. Okay, so we're going to play a little, very, very short. It's very, very short. It takes about 1 minute or less than that. Okay, so it's guess the medication based on the emoji version. I only have 2 drugs, not too many drugs that I need you guys to guess. The first one is a bit easy, so put it in the chat box what you think it is, and then let's see if you guys know. So first one, very easy. You should know this. Put it in the chat box, and I'm writing down your questions, so don't worry about missing it out in the when you're sending all the medications in. So in the chat box, what medication is this? Okay, fine. The first person got it. Okay, very easy, right? Carbamazepine. Okay, now we're gonna go a little bit more harder. But before that, let me just very quickly share for those of you who are new. Okay, I got a slide here just explaining a couple of things about carbamazepine. Okay, so very quickly, it's usually we use it for epilepsy, trigeminal neuralgia, and we also use it for maintenance therapy or acute mania in bipolar disorders, especially if lithium is giving a lot of issues. Right, so this is when we use carbamazepine. These questions, carbamazepine has come in the AMC Clinicals, which is why I picked this station. Your side effects, it was also asked. Okay, next one, last one. Okay, this one is a bit harder because I've only put in the side effects of this medication in the okay, so these are the side effects of the medication. When is the best month? Yeah. So what is this drug? What is this drug? I've only put in the side effects, so a little bit more squeezing of the brains for this one. Materials. Two. Okay, I'm still writing down the questions that you guys have, so I'll scroll down to see the answers. No, not lithium, not pinpoint. Okay, almost there. Yeah, Amy got it. Yes, doxycycline. Anybody want to explain why is this doxycycline? How is this doxycycline? Anyone want to explain before I give it off? Hmm. Anyone want to explain how you got? Amy, want to explain how you got to doxycycline? And Adira, you want to explain a little bit? Yes, photosensitivities. That's the first one up there. Uh-huh. Push a little bit more. Okay, I'll show you. Yes, the enamel staining, the antibiotics picture. Okay, fantastic. So I have a slide breaking it down for those of us who are new to AMC Clinicals. It's okay, okay? So doxycycline is a very common drug that we use for chlamydia. So one of the very popular STI counseling cases in the AMC that you have. So doxy, yes, photosensitivity is there. It's a broad spectrum antibody that we love to use. The color in the past, it used to be a bit yellow and red, in yellow in color. And of course, it has your enamel staining. And we try not, in fact, we don't try not to give it during pregnancy and into babies. Okay, best, let me just wind up to see the other questions that you guys had. So someone asked about best month and recalls repeating. Okay. All right. Let me just very quickly ask, can I start the session? Okay. So in the meantime, if you guys have any questions during this session, please post it in the chat box. It'll be a bit more easier. I usually pen down all the questions that you guys have. And if I forget to tackle it during the session, I will tackle it after the session. Yes, Deepak, I saw that question. Don't worry, Deepak. I saw that. Okay. Okay, how many DDX? Yes. All right. All right. Oh, sorry. Yes, this was doxycycline, by the way, and explained to you. Okay, now let's start proper. Now, first of all, I know that there are quite a number of candidates here who are very fresh from AMC 1. So I know there's also a whole group of people who are like, Love, I just want to know how to book this exam tomorrow morning when I wake up. I also know that a lot of you are here. But bear with me for a couple of minutes while I take our freshers a little bit. I know they're experts here too, okay? So AMC Clinicals in general, it's a total of 16 stations. Now, in the 16 stations, you would have two pilot stations. In the two pilot from the two pilot stations, they're usually not scored. That's why it's called pilot stations. They're not scored. And you have 14 scored stations. Now, within this 14 scored stations, you need to get a passing score of 9. Well, back in 20, they only changed the passing score very recently. In fact, last year or last year. Prior to that, the passing score was 10 for each AMC Clinicals round exam. So now the question is, Olaf, is it any harder or is it easier because the passing score is, it's a little bit lower? To be very honest with you, the overall passing percentage still roughly remains the same in the AMC Clinicals exam. I would say that it has gotten a little bit more challenging. Within the task itself, your management cases are increasing in your cases. In the previous times of many couple of years, history questions were very popular, but I think all of us are starting to nail history questions that now they're shifting their look towards management station. So for those of you who are new, which means you need to brush up your management. So it's not about knowing the exact dose, but it's at least roughly knowing what drugs am I going to use, how am I going to proceed with my patient. So that should be the focus for the few of you who are, for those who are booking your exams in tomorrow and getting your dates in a couple of weeks to come. Okay. Now, so in the exam itself, you're very aware that there are many different tasks, and your role or your goal rather is to go in and answer the task and come out. Now, if you start giving things which is out of the task, you will not be scored for. There is no marks for saying things which is out of the task. Now, these are the examples of the task out there. So have a little read while I scan the chat box. History taking was very popular, still is very popular. You would definitely have history taking in majority of your stations. Now in the past, or still currently rather, 4 minutes and 6 minutes history is quite popular. The minute you see a 6 minutes history taking, You would know maybe the predominant assessment area of this station is history taking. However, in the couple of weeks ago in the exams, we have been seeing 3-minute history taking and 2 minutes history taking, which means you are required to know what exactly do I need from this patient for me to complete my remaining task. And this will purely only come from practice and exposure from various cases. Now, PIFI is called asking physical examination from examiner. PIFI is very different from how you do your physical examination stations. Physical examination stations require you to execute everything and gain your findings through the execution of your physical exam. However, PIFI is just you standing and asking the examiner back to back on the kind of examinations that you will require in your station to proceed. If you are practicing or doing PIFI task in your exams, no more than 90 seconds for your PIFI task. All right. Now, diagnosis is a very common station, that's a very common task you will see in majority of your stations. Now, differentials is something that I want to tap on because quite a number of you asked about differentials in the chat box. Now, every time, yes, in the marking results script, which I will show you a couple of marking results script that I've asked permission from my doctors to share with you guys, there are stations which requires you to mention differential diagnosis. Now, in these stations, they are not only expecting you to give many differentials, but they're also expecting you to rank them in a selective order. So if you read, this is a resource I'll show you on later, where it's called Tips from Examiner. So in the Tips from Examiner, it will say that they require you to give a prioritized selection of differentials. The more prioritized they are, the more relevant they are to the STEM in front of you, the higher your scores. So what do I mean? So for example, let's say we have a case of a 21-year-old girl who's coming to you with a complaint of amenorrhea. Okay, so amenorrhea, for those of us who are not familiar, you have primary and you have secondary, is when you don't have your period for a particular amount of time. So in secondary amenorrhea, what happens is that to diagnose secondary amenorrhea, in a person who's having regular periods, 3 months of not having their period will now lead to, you can now diagnose them as secondary amenorrhea. In a patient with irregular periods, if you have 6 months of no periods, then you can tell them that maybe you have secondary amenorrhea. There's so many causes of secondary amenorrhea. But now, if a case is presented to you of a 21-year-old female and you're required to give a couple of differentials, let's say, there are a couple of doctors who might suddenly just, amenorrhea, I only can think of primary ovarian insufficiency. And you start just throwing out differentials that you remember very quickly, and you throw primary ovarian insufficiency. So if candidate A says primary ovarian insufficiency and then goes to perimenopausal and then says PCOS, this doctor might not score as high compared to another doctor who says thyroid problems, PCOS, pregnancy. So do you realize the age of your patient will change how relevant your differentials will be in your stations? This is something that you guys need to start focusing on when you're doing your differentials cases. It is just not going out there and mentioning all the differentials that you know. You don't get your marks like that. And there are also a couple of stations where the task will not say, give your differential diagnosis with reasons. However, okay, for those who are my second-time sitters, you would know that when your result script comes out, there will be a portion will be like diagnosis/differential diagnosis. Your marks were low or the marks were high. But love, the station never asked me for differentials. Why am I marked for differentials? Now, the reason and concept is very simple. Through your history-taking station or your task, the examiner expects you to rule out differentials. So it is just not, AMC Clinicals is just not about getting the right diagnosis. I am sure you would have heard doctors telling you, oh, I actually didn't get the right diagnosis, but I passed the station. Because the goal of the exam is to show the examiner your train of thoughts while you reach your end goal of the diagnosis. As long as you show that you are ruling out differentials, you are confirming your diagnosis, and you got to a decent management plan, you will be able to clear your case. Okay, you'll be able to get a pass in your station. Of course, in those doctors who missed off, say like, oh yeah, I didn't get the correct diagnosis, but I passed the case. I'm very sure that in their top 3 diagnosis, or when they were thinking about the case or the cause of the thoughts, when they were explaining it to the examiner or the patient, they would have tapped on the common differentials or the diagnosis that was intended for that case, which is why they would have passed the case. Right, so let me repeat one more time. It is not about getting the right diagnosis in AMC clinicals. Of course, that's a bonus and it's ideal. With a good history taking, you would definitely be able to get a correct diagnosis. But the examiners also require you to rule out differentials using your history taking. And if some of you are confused on what that means, so for example, in a fever and rash station, for example, let's say you asking me about, let's say fever and rash in a pediatric case. If you ask the patient, oh, how's your urine like? Any changes? And the patient's like, oh yeah, no changes, doctor, everything is fine. Now, this is a very superficial, simple question. Every patient or every doctor will ask your patient, how's your urine like? But a doctor, can it be who's asking, how is your urine like? Has there been any changes? Pause. Follow up with, has there been any kind of blood in your urine? Now, this is very unique to HSP. Following up any abdominal pain you might have or any rashes you might have, now the examiner has gotten the fact that you have ruled out HSP in your case. So unless otherwise in a fever and rash station, if you do not ask for neck stiffness, which is a very big red flag, the examiner will not be able to give you a tick in ruling out meningitis in your station. Is that clear enough? So for those of you who ask me how many differentials I must mention at the end of it, unless your station asks of you, you give prioritized selection. If it doesn't ask of you, then in the history, at least about 7 to 10 differentials in your history taking, if possible. Now, the other stations that you have or domain assessment areas you have are management, counseling, and interpreting investigations. So I'll show you guys a couple of results slip that I have from these different ones. Now, when you look at domains, so these ones were tasks that we looked at. Now we go back to domains. It's a bit different, a bit similar. It's an overlap in a couple of things. So approach to patient. Now with approach to patient, you must understand one thing. You are being marked for this for the entire 8 minutes of your case. It is just not a particular one moment that will be like, oh, okay, doctor is having good approach to patient. It's at the end of it, did the patient have good rapport with the doctor? Were they comfortable? Okay, that's what approach to patient essentially is. And let me tell you, with IMGs, not very difficult to score with approach to patient unless you take a very robotic approach. I have a couple of doctors who get very anxious and very stressed in these stations, and then they're like, oh, love, I forgot to talk to the patient. I was just going down my entire list of questions. In those cases, yes, approach to patient score might be slightly lower, but otherwise, majority of the doctors approach to patient, not an issue, okay? Now, history taking is all of this I've mentioned. Now, physical examination stations. It is just not about executing them, but it's about the structure. Now, to know a little bit more about structure, especially for physical exam, I will be sharing resources later, but let me just tap on them now. Telly O'Connor is an Australian-based book that has been made for physical exam. These are Australian doctors who created the book, so it's a very good reference and touch point to check on. If for those doctors who are already working in Australia, I know a couple of you might already be RMOs and interns, please ask the Australian medical students, your year 5s and year 6s. Now, these doctors really have really good physical examination skills and techniques because they are very fresh from OSCEs. They do OSCEs every single month. So please ask them about approach. Please ask them about accuracy. Now, I think in our home, the one thing that IMGs struggle with in the home countries, a few of the P is done very differently, or for many of us who learn from our consultants or supervisors, there's of course a very quick way to do an examination, and there's the very right theoretical way to do things. A lot of us might be learning from consultants who are very experts. They know everything very quickly and they just feel the abdomen. They already know the mass inside of it. However, this is an exam. It requires you to have good choice, good technique, and good accuracy. So unfortunately, you have to follow by the books. For when it comes to physical exam, you have to do it right from head to toe. Okay. Now, we spoke a little bit about differentials. That's also a domain area that you're usually marked on. Choice and interpretation of investigations really depends on your station. If that station provides you with lab results or provides you with imaging, then yes, this will now become a domain assessment area for you when your result slip comes up. Or if there's physical examination asked from examiner, you would also see this domain area appearing in front of you. For management, patient education counseling, very straightforward. As long as you see management in your stations and as long as you see counsel the patient, if that's a task that you have, you know that one of these will be your domain assessment areas and you will also be marked accordingly in them. So now in the exam, when you get your result slips, you would have three different scores, right? So at the top of your result slip, you will have your overall grade or pass or fail. That will be one grade for you up there. The other one that you'll have is within your station. So within your stations, you would have the individual domains. Each of them will be marked to a score of 7. Okay, 3 is a fail, 4 is a pass in that particular domain. And overall, there will be a global rating score for each station. So irregardless of the domains that you have in front of you, how you make the examiner feel. Are you a safe clinician? Does the examiner feel that, yeah, I can work with this person as a colleague down the road? Do I feel safe? That is what gives you your global rating score at the end of the day. So I have seen results, which I'll show you in a couple of minutes. I have seen results where it's a very good 4, 4, 3, and then 4, and then they fail overall, or 5, 5, 4, 3. You know, you're like, it sounds like a good pass. You know, there's 3 very small slip in one of the domain areas. Still, overall, it becomes a fail in your station. Okay, so just because you nailed all the domain assessment areas doesn't mean that you pass globally. And otherwise, I also have doctors where it's a 4, 3, 3, 4 in the domains here, which means they actually didn't clear 2 domains. However, they still passed the station overall. So maybe there was something right that they did, or they avoided all the critical errors in that station, allowing them to pass that case. So very lucky. Those doctors are very lucky. And I'm very happy that they actually passed those stations because it's something that they're doing right. And I'm sure for second-time sitters, you would have seen your results script and you would understand that, hey, yeah, these things happens once in a while in my station. Now, I put a little screenshot here for the assessment criteria. Now, this assessment criteria can be found in the AMC Clinicals website, okay, your AMC website, when you click under AMC Clinicals, and if you open up the documents that they have for you to read, you would be able to see the assessment criteria and various other documents they actually have for you. And if you have time, maybe February doctors and March doctors, maybe not too much of time, but for those who are booking brand new, for those who are sitting from April and May onwards, please read these documents. I've always said that we can't enter an exam without knowing the rules or the boundaries of the game. We need to know the rules, we need to know how it's played, and played according to their rules in the game. That's how we score in the exams. You need to know everything about it before you go into it. It is just not constant role plays or just not reading, and memorizing. That's not the only thing that will allow you to pass this exam with very bright flying colors. Yeah. Now, these are examples of a couple of stations. So usually this station is if you look, let's look at the results. For those who are not familiar with it, this is a predominant assessment area of management, counseling, and education, right? So in that station, it has been broken down into history, patient counseling, education, management plan and approach to patient and relative. Now, this candidate has done extremely well, I would say. Okay, very good scores, very happy scores. The maximum you can get in a station is 7 for each domain area. So this is a good news station. And I'll show you a couple more stations, not too good ones. Now, in this one, if you realize, it's also a management and education counseling station. So look at this very closely. Okay, you would actually notice that, hey, actually this doctor did quite well, right? The only problem happened was the doctor slipped, or maybe this doctor in the shortness of breath station did not say something right under this management plan. Something was missing, and it was a key point perhaps, which is why this doctor ended up not clearing this station overall. Okay, so this can happen at times if you miss a very big key point in your station. Now, if you look at the one at the bottom, this is a physical examination station. So I'm trying to show you various predominant assessment areas that you have and little ones at the bottom. So in this case, it's a hand problem. Now, if you look at it, it's a physical exam station. So this is very straightforward, typical of physical exam stations. Okay, it doesn't really change unless otherwise investigations are given to you prior, an X-ray is given to you, and then yes, PE might change a little bit. Otherwise, this is always the way a PE examination is tasked and examined. Okay, I'll show you guys a couple more examples. Now here, I wanted to show you guys a history-taking station. So you might ask me, Lav, if the predominant assessment area is a pass, does that mean I will clear the station? And this will tell you, unfortunately, no. So this doctor has got a history of 5 fantastic scores, actually, very good. 5.7 is fantastic. In 3 for PFI, so that which means this station had a physical examination from examiner task. That's what you can understand from looking at this result slip here. And then you move on here, something was off here. Either the diagnosis was wrong, or perhaps the differentials being elicited from the history was not enough. Or if there was a differential task in this station, it was not in a prioritized manner. That is what you can understand by looking at this result script once off. Okay. Now, this one is another one I wanted to show you guys because this is diagnostic formulation, another type of domain assessment area that they have, another PDA that we would say it's having. This one, decent scores, decent pass, very marginal, just clear, 445. So even if you get 44444 and all, you should be allowing you to pass this. I've never really seen a 44444 and an overall fail before. Okay, usually one of the domain areas will be shaky in such candidates. Any questions with regards to the result slip and the exam and the structure? Now, I had a couple of questions regarding the exam. So, now the AMC exam itself, you'll be given 8 minutes to present your case and 2 minutes to read your station. You need to understand, especially for face-to-face exam, only in your first station do you get 2 minutes to read. All right. In subsequent stations, you do not get 2 minutes to read because, so let me just pretend how it is. So you're standing outside of your room waiting to go in. Now the 2 minutes starts, the TV opens in front of you. You read your stamp for 2 minutes. This is your first station, right? Now, when the bell of the 2 minutes rings, your 8-minute timer has already started. So you are going into your room, you're saying hi to your examiner, you're communicating, you're doing your case. Now, while you're still doing the case, the 8-minute timer will ring. So the universal timer, 8-minute time will ring. You have to leave your station. However, at this point in time, some doctors are still inside saying, thank you very much, role player, thank you very much, examiner. And then they come out of the room and then they move over to the next room. So this will take your time about 15 to 20 seconds of your time. So when the 8-minute finishes, the 2 minutes already started, but you're still inside. Unfortunately, this is the reality of the exam, right? And when that happens, you also need to remember that as human beings, we are not very perfect. And our mind might still be in the previous station. You'll still be, I should have said this, I should have said that. So even though physically you're in front of your second stem, your mind will not be 100% in front of your second stem. So you need to give yourself the buffer, which means ideally you only get about 1 minute 30 seconds to read your second stem. And this repeats all the way until your last station. So only in the first station you get your 2 minutes because they line everybody up in the exam and then they start the 2-minute timer. Otherwise, it's just 1 minute 25 or 1 minute 30 seconds, which brings me to the point that when you are practicing, if you are brand new to AMC Clinicals, I would say take your 8 minutes, take your 2 minutes. However, as your exam dates are getting closer, you need to cut down the timing if you want to make sure you can read the stem there in front of you. Okay? All right. Any other questions with regards to, I will be tapping on resources later on after I talk about exam booking, but any questions with regards to roughly how this exam is done, how is it marked, you know, how to prepare roughly, what you're going into. It might sound very scary. Now I have a question here. Punit, I'm not very sure. I think we can ask the admins. And 77553. Wow, Deepak, this one really depends on the examiners, to be very honest with you. Because it depends where the 3 is. If the 3 ends up being a domain assessment area, and let's just go back to the fever and rash station. Let's say you did everything exceptionally well on the fever and rash station, but you forgot meningitis and you forgot to rule out malignancy. That is indeed a very big red flag. So no matter how exceptional you are, right, you will still not clear that station because red flags are crucial in the AMC exam. How many stations? So it's a total of 16 stations that you will have to go through. So 20 stations, okay? 4 rest stations, 16 stations of cases you have to do. In the 16 stations that you have, Sujata, you would be having 14 Scott stations and 2 pilot. Will you know what the pilot stations are? My answer is no. You can come back home after your exam and think and crack your head, but until your result comes up, you will never know which are the pilot stations. And some cases might look like it's very, oh, this looks like I've seen it before. And then you look at your results like, oh crap, how was it actually a pilot station? Because pilot stations, when the examiners do, when the AMC does that, they either just change the timing sometimes to see if it's working. They change the task, maybe from management, they're changing it to history. It's very, very minor tweaks, even minor changes in the language of the way the STEM is presenting. Maybe the previous time they put the STEM in pilot, candidates did not really understand the task. So maybe now they are rephrasing it to see how the station works, right? So that's how a pilot is. So it might look like a very familiar case, even this fever and rash that I keep bringing up. Like, yeah, I know this is scarlet fever. Yeah, I know this is Kawasaki. Yes. However, when you come on, like, oh, that was actually a pilot station. Now you need to pass 9 stations, Sujata. 9 stations. Ideally, of course, aim for the sky and then you fall a little bit on the clouds, yeah? Or aim for the stars, fall on the clouds, yeah, that's what it is. Okay, so aim a little bit more. So 9 is the passing. I would say push yourself to aim for 10, 11, or 12. You fall slightly lower. A lot of doctors who end up aiming for just 9 sometimes slip into 8 or 7, and it's very, very unfortunate. So aim higher. Now, do you get real patients or just clinical scenarios? So, no, you get clinical scenarios. Dr. Pratik, well, can you imagine having a heart failure patient going through one entire day of 40 patients? They will really get sick and more severe after the case. So usually they try to bring clinical scenarios to you. But recently I've heard that one of my doctor, it was just very recent on the 3rd of February, okay, one of my doctors was able to hear wheeze in his respiratory patient. So I'm waiting for my other doctors to see if they heard a wheeze as well. So I don't know if it's changing, but up till now, it has usually been always been clinical scenarios. And in your pediatric stations, you never get the kids there with you. Okay, the kids are never there with you because it's so hard to get kids to act 20 times without any biasness and having the same answers. In fact, 40 times the entire day because there's 40 candidates every day. So in pediatric stations, you usually have the parent in the case. Now, how many rest stations? You have 4 rest stations. Okay, so let me just bring you back to that slide that I had. Here, 16 stations in total, 14 scored, 2 pilot, which leaves you with 4 rest stations. Any other questions about how many questions or how many stations before I move on to the booking, which is a very stressful day for everybody tomorrow. Okay, let's move on to the exam booking. If you guys have any questions about the exams, feel free to ask when I'm doing the resources later. Just put it in the chat box and I'll take note of it as well. All right. So I believe majority of you would have gotten your emails telling you that you can book your exams, right? Okay, so this is what you should have received. Now, many of us were wondering if, is it okay, love? They tell me it's a preferencing and I have time to do the preferencing. Can I wait a little bit before I do the preferencing? But I was reading it very clearly and thoroughly, and I realized that there was this line here that said, candidate preferences will be allocated on a first received, first allocated basis, which means if the portal is opening at 10 a.m. AEDT tomorrow, you have to be ready at 10 a.m. at that time. Log in, go put in your preferences. Okay, that's why I just checked it today to see if there's any new updates in the AMC Clinicals website. So this screenshot is from the AMC Clinicals website directly. All right, so please go in whenever the slot timing opens. Now, payment has always been a problem. It's been very challenging for many doctors, especially those of doctors who do not own credit cards. So this year, this booking time, the AMC has allowed both credit and debit cards. So please be, either way, I would say just have both as a backup. But if you can want to use a credit card, use a credit card first. You would have 15 minutes to make your payment time. And this year, it's a bit different. So let me bring you through this. Have a little read on this. I'm sure majority of you would have already had this, while I just note down the questions from the chat box on my paper here. Okay. All right, so tomorrow morning at 10 a.m., please log in. Make sure you've already checked if your not your internet, if your password works. I've had a time where I had to reset my password before booking, and it was such a traumatic experience. All right, so please go and get that done today if you haven't. Nothing will change today. So if you go down, basically it will tell you all the way at the bottom of your dashboard, right? It will tell you eligible for AMC clinical examinations. That's what it will tell you. Tomorrow you have to click on that. Once it's 10 a.m., it will turn on open. You can click it. You can then book for it. Okay. Yes, you can click on the dashboard and then clinical exams will appear. All right, so let's take a look further. So this is the instructions that has been given to you. Okay, this mode was done in 2024, when I first booked my exam. This was the method that we used. It was a preferencing method. So I'll take you through a little bit. So once you go into your portal and you click on your AMC Clinicals booking, okay, on clinical exams, you would have to select your preferences. So it will be preference 1, preference 2, preference 3. Now in preference 1, you would then have a little box beside it to scroll. Scroll and find the date that you want. Okay, it's not the month, but the exact date that you want. Whether you were offered AM or PM, is not relevant. Usually, it's when I was booking, that was in 2024. Okay, now it's 2026. I'm telling you based on 2024. Okay, there was no AM PM option. However, this year there might be an AM PM option. So just be very careful about it. So scroll down to your date, click it, and then don't click submit preference yet. Okay, you need to put all 3 preferences. Make sure you can see 3 different dates on your page before you scroll all the way down and you click submit preferences. Do not rush to click submit, because I've had a doctor who panicked, only put 1 preference and thought it was 1 submit, 1 submit, 1 submit. So in the end, she only ended up submitting 1 date to the AMC Clinicals. Well, good news is she got the 1 date, but it was a very, very uncomfortable date. It was the first week, and she's like, "Love, I really don't want the first week." So unfortunately, that's what happened, but she got a date, most importantly. Okay, so pick your dates, and then you would press your submit button. Now, once you have submitted, right, you would see this thing, your placement preferences have been received. Please check your email. So I'm going to show you a sample of how the email will look. Okay, now this, I've blocked it off, but this was actually mine previously. All right, this is how it will look. This email will be received by you. Ideally, please use a laptop. Okay, ideally, please use a laptop for the exam, as it's a little bit more easier, I would say. With an iPad, it might be a bit difficult to start maneuvering. With a laptop, you always have you can always click anything and everything. And also the other thing is this, make sure in your laptop, do not log in multiple access to your account. Just one time login in on one browser. Do not go. Google Chrome is better. I've heard about that. Google Chrome is much better compared to Safari or Firefox. But all of them actually work equally fine. I think I would rank it Google Chrome, Firefox, and then Safari if you want to use Microsoft Edge. I think it's good, but it's not as strong compared to the rest because it's a bit more newer compared to the others. Okay, so use those ones, use a laptop. Now, once you have received this email, it just means that your preferences have been submitted. Just make sure your order is right. Unfortunately, when you get this email, there's nothing much you can do. Okay, even though you realize, man, I mixed up preference number 3 and 1, nothing you can do. Okay, you just got to be like, I hope they give me the date. I just need a date. That's what you need in the exam, right? Now, let's move on to the behind part before I show you the next email that you would get. So on 18th of February, ideally, okay, on 18th of February, you would be notified by an email with your placement offer, with your payment instructions, and you got to make your payment by 23rd of February. Now, when I did my booking previously with this method of preferencing, as much as they said that you would get your placement letters 1 week after, okay, 1 week after the exam, what happened was, I think there was so many people who booked the exam. Within a couple of days, we actually already got our placement letters, right? So just be careful. Just check in your email. Turn on your email notifications. So this is how your email will look like. This is when, after 1 week, okay, when you have gotten your placement letter, not placement letter because no payment has been made. You've just been offered a placement, right? So they've offered you a date. So thank you for providing your preferred. You have been given a date, da 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 da. So please make your payment to confirm your placement. You'll be given a couple of days to make your payment. They're very kind of that to do that. I think we had only 24 hours the previous time. You guys have a little bit more longer, between 17th to 23rd of February to make your payment. But of course, once you see it, I would say do not waste too much of time. Just go make that payment, start preparing for your AMC clinicals. Yeah? Okay. In the meantime, while you guys are reading this email, let me just very quickly scan through the chat box. Should I go? Well, I know a couple of you guys are wondering about when you should go. To be very honest with you, look at how prepared you are for the exam. To be very honest, for me, when I picked, I think you guys saw, right? I picked what did I pick? This was mine, by the way. So I picked one in October and then I picked two in November. Okay. I got the October slot. So honestly, it really depends on you. It depends on your commitments that you have. Some people are pregnant, some people are married, some people are going into labor soon. So you have to plan your timing accordingly. But for those of us who are fine, I would say anything is actually all right. Because I actually did a poll recently on trying to figure out which dates majority of the doctors want to go for. Unfortunately, I think there are enough dates where there's only about 23 to 24% wanting to book in every single. So it's a very equal amount of spread of doctors wanting to book in the various months that are there in your exams. So let me just very quickly show you the months that are available. You actually have a lot of dates this year. Okay, it's very, very amazing of the AMC clinicals. So these are all the dates available. If you didn't receive the email, you can refer to this on the AMC clinicals website. Dr. Shani, you said does booking at the end of the week matter? Do you mean not booking it tomorrow and waiting for a couple of dates? Yeah, it's only 26, so it's very hard to tell. Do you mean booking like at the end of the week, like not tomorrow? You have to book tomorrow. You put in your preferences tomorrow. Okay. Which one to click? Let's see what Dr. IG has sent. Okay, let me open it up. Yeah, clinical examinations, man. So click clinical examinations, and then once you click that, you'll be able to automatically will bring you to the booking site tomorrow. So dashboard, then clinical exams. Okay. Oh, okay, Dr. Shani, I get your question. Yes, let me address this very important question. Now, a lot of doctors come from AMC 1, right? AMC 1 is very much where Friday you have a lot of recalls because Monday, Tuesday, everything is like very similar questions. AMC Clinicals is nothing like that, people, okay? Nothing like the AMC 1 at all. None of your recalls will, nothing is, if you in fact start looking at how the questions have been coming in the AMC exam, there's zero relevance sometimes between day 1 and day 2 and day 3. In fact, in the entire month, it's very hard to find repetitive questions. Maybe in clusters, in terms, like when they say now having from May to August versus last time it was November to Feb. Yes, in those groupings, perhaps you can find similarities, but nothing happens within the months of the exam. So you have to be prepared for any case that is brought in front of you. Okay, now tomorrow's dates, Dr. Linda, are opening up for May till August. So the dates in front of you, so May till August, will be there. I have the dates for August. Now, Dr. Deepak, the dates will not disappear in minutes, okay, because it's a preferencing that you are putting. But even if the dates don't disappear in front of you, it doesn't mean that it has not been filled up already. And because I brought you to the previous slide where the AMC said that they will be giving you your, where is this slide now? They will be giving you your dates based on first come, first serve basis. The faster you select your 3 preferences, the faster it gets locked into the system, the higher chances of you getting a date for your exam. It's just that if number 1 has already been filled up, you have another option to fall back to, which is a bit more easier than the previous times. Because previous time is you have to click on your own, then you go back, right? Then you click again. By the time this day is already over and it's finished and it's disappearing. In this case, no, it doesn't. Your timing gets locked down to this second. Okay. Let me see other questions here. Where you get the recalls, Dr. Shani. When you start looking at the recalls, you realize it's nothing like that. But there are a couple of groups, I'm sure, that they do have them. Will morning candidates get in touch? No, I like how you guys are trying to find loopholes in this exam. No, okay? AMC is extremely smart. You will never ever get to know the questions that you are going to encounter. Zero. Okay, morning people will never ever meet the afternoon people because they get all the afternoon people checked in, registered into a room before they release the morning people and get them to go out of the building. They don't even let you to go toilet. Okay, when your AM doctors are leaving, PM doctors can't even go to the toilet. Okay, they will tell you no toileting for the next 5 to 10 minutes because your doctors are leaving. That's how this exam is done. So zero. Okay. Any differences in selecting AM and PM? Well, the only difference to it is that if you're a PM doctor, your waiting time is slightly longer. So because now the AM doctors are still inside, they've already checked you into the room. Okay, they've already checked you in. You are waiting for the AM doctors to leave. Then you're also waiting for your role players and examiners to go for a very quick break because they are very sure they're very tired. So they go for a very quick break. So I took the PM slot the previous time and I had to wait about 45 minutes to an hour before my exam actually started. So of course, if you can handle that anxiety of waiting for 45 minutes and just staring at your fellow other doctors, you can pick the PM slot. If you think I want to get it over and done with and I can't be waiting for this exam, then pick the AM slot. And especially for my pregnant moms out there, if morning sickness is a problem for you, please avoid the morning slot. Make sure you get yourself better, drink some lime juice, get yourself steady, and then probably I would suggest go for the PM slot, especially those of you who have conditions which will affect your morning performance. Okay. Yes, Dr. IG, I never got your name fully, but Dr. IG, yes, in that time where you are locked in that room, you can hold on to materials, but not computer, like not digital materials, but you can hold on to written notes. But I would suggest to just rest and chill, calm your brains down. Honestly, nothing is gonna go in the last couple of minutes, is it? Okay, what other questions do we have? Any dates opening tomorrow from July to November? No, Linda, I've answered that one. Um, how many slots per day? So Dr. Punis, sorry, let me just bring you back to the dates available. Sorry, here. Now every day they're only opening 38 or 36. I can't remember. You guys need to go read the emails. They're actually 40 every day, but I believe they leave the two just as a buffer. Okay, so they're only opening 38 per day, which has about, I did the math actually the other day. It's about 1,140 something dates this opening, which I think is fantastic because there was a time you only used to have 300 or 500 slots. So they are doubling and tripling those numbers. So that's honestly fantastic. I think majority of us have a chance on getting a date this time around. Any other questions with bookings before I move on to preparation, which many of you guys had a question with? I don't understand the exam code. No, it's just an exam code, Mala. It doesn't make a difference. It's not morning or afternoon. I think it's just how AMC does. Every time they put the same thing. It's just a way for them to remember things. Don't be stressed by that. But every day has 2 a.m. Every day has AM and PM slots. How much is the fee plus GST? Well, I honestly can't remember because when I booked it, it was 4,000 plus plus plus. But now I know the prices have gone down. So please, somebody help with me. Check out 3,000. So 3,000, fantastic. When I did it, it was really expensive, guys. Okay. Deepak, yes, they might. So when you scroll through, they might offer you AM or PM. So I'm telling you, when I booked in 2024, there was no AM PM preferencing. All right, it was just a poof, it was just given to you as an option. However, now they might have, or they might just give it to you as a schedule. When you get your email, then you'll find out, oh, I'm an AM candidate, oh, I'm a PM candidate. They might not offer you. But if you are given an option to pick AM or PM, please take note of your body health before you book. Okay, and if some of you are flying in late to Melbourne to write the exam, doesn't make sense to go for a morning paper, guys. You guys need to rest a little bit. So go for the afternoon paper if you are given an option. So please think about all of this before you book your AM PM if you can. Any questions before I run you guys through how should I prepare? Now, a lot of you guys were asking about recalls in general. Well, I would highlight again towards the end of it, but Med Exam Expert is having a recall workshop. okay, and starting from 26th of February. It's a 2-week workshop, so you guys can join that as well. But I would recommend that probably those who are going to go for the exams really soon, or even for those who want or get a feel of how the exams are, you guys can also join. So I will share that at the end again. Now, let me talk about the resources to prepare first, and I'll answer your other questions. Dr. Prajit, how to reduce stress? Very difficult, man. Just play some music. Okay, do you mean booking stress or exam stress? They're all different types of stress. But honestly, one thing to note is that when we are very anxious and stressed, especially tomorrow morning when you guys are booking the exam, you might start to make a couple of mistakes when you are booking. So make sure that you try to be as calm as possible when you are booking your exam. Okay, slow is fast, calm is also fast. Remember that, and when you're doing your preparations. So now, this is a screenshot from the AMC Clinicals website as well. So this is roughly what they've given you on how you should prepare. So please run through these ones. I will show you a couple of things. Now, the first thing that I have is if you look at the bottom, there's this thing called Tips from Examiners, which is something that I really love. And let me show you how good is it. So in the Tips from Examiner, it's a 30-page document or 25, I can't remember. It's a very long document. Please have a read of that document. This is a sample. I took a screenshot from it. They actually tell you what to do and what to not do in the exam. So just now we were all discussing about differentials, right? So I brought in a little bit on that part where you see things to avoid. Giving a long textbook list of possible diagnoses bearing little relationship to the particular features or the scenario. So these are actually things to avoid, and these are mistakes that many candidates have been making over time and time. Like, I just can't pass this exam. Well, it's because we are not reading these things. Now, Dr. Nafisa, you asked it, so I actually have it here. Okay, so under clinical examinations, okay, if you go to the AMC Clinical Exam website, okay, let me just very quickly share the link over to you guys in a bit. Now you can click on tips from examiners. So I've already opened it for you guys actually. The screenshot I kept. So it's only 9 pages, sorry. It's a 9-page document. So have a read of it. Okay, they actually explain every single domain area for you. Okay, things to do and things to avoid and how you should tackle that particular task. Please read this before you go for your exams. Very, very important. Of course, booking a date is more important than securing one, but once you've secured, do all of this. So even a lot of us will tend to say that, oh, you have a condition called an upper airway problem. But again, tonsillitis versus pneumonia are two different things. And when you just say, oh, we have an upper airway and a lower LRTI, you don't get a lot of diagnosis answer and of marks from that. So clusters don't get you marks. You need to be very specific with the diagnosis. And all of this will only be learned when you look through these things. Okay? Oh, let me share the link with you guys first. Give me a bit. I just did a. It's all it's all in the AMC website, guys. Okay. Please open, dig, and read through that. It's really, really a golden place to find things. In fact, they also give you resources that you can tap on there, and they give you also the assessment criteria that I showed you. So let me just very quickly show you the assessment criteria that I showed you guys just now. This is the not this one. Now, this is the assessment criteria. Let me go all the way up. This is a 30-page document I was talking about. So this is everything about AMC Clinicals exam. It talks to you from the aims of it to the objectives. Okay, it brings you down to the key steps, domains, global rating. If you want to go for a remarking how these stations are actually recorded, and if the examiner is not able to mark you correctly, they will actually watch the recording again and they will mark you. All of this is present here in the document on the AMC website, the link that I just sent you guys in the chat box. So do have a look at that. Okay, so it really has a lot of things. They do update that pretty often. The recent update was a while ago, but I do check it for constant updates to see if anything has changed. So far, nothing has pretty much changed from that. Okay. Now, the other golden resource is the AMC Clinicals Handbook. I know now a lot of AMC 1 doctors would say that when you guys use the AMC 1 or AMC MCQ Handbook, it might not have been as useful because you guys are very dependent on the recalls. However, AMC 2 is very, very different in this exam. Now, the AMC handbook, I did hear that AMC is attempting to release or have thoughts on releasing a new one. So let's wait in for that. But this book was released in 2007. It is still one of the golden resource because It is the only answer key that you have on how AMC is marking this exam, right? So let me show you what do I mean. So when you look at these stations, they do give you a stem. This is exactly how things will appear in your AMC exam. Okay, this will exactly be how things will appear. Now, the tasks are very specific. So I believe that for many second-time sitters or those who have already has gone for this exam or started preparing, you would realize that when you see the recalls in front of you or when other doctors send you, they just give you a one-liner, history, PFE, DD, DDX. But then when you start looking at the handbook, you realize that the tasks are actually very, very detailed, right? It's just not as short as the way it is. Yes, Dr. Nafisa, the guidelines might be outdated, right? However, medicine doesn't really change so much. Yes, management changes. Management changes because it's improving according to the time. We have technology and new research, but the way a case is done, the structure and thought process hasn't really changed. And that's what you need to get from the AMC handbook. So if you look at the handbook, what I need you to catch is, so for a simple case of headache, when you start reading this thing, you would realize that it will start showing you on how you're supposed to do the case. So ideally in that station of headache, you should have elicited all of this in the case, right? In physical examination, if you do not elicit these key points, you might not clear the case, right? So neck stiffness, ophthalmoscope, and blood pressure are key findings in headache. So your goal is to be like, okay, if I have a headache case next time in the AMC, my role or goal should be I have eliminated all the red flags and I don't fall into the critical error that this station has. So if you go on and look here, look at the critical errors. If you do not ask a blood pressure ophthalmoscope findings, okay, or you start diagnosing this patient with a very big problem and it's just a very simple tension headache, then you might not clear the case. And these concepts will remain the same no matter how many years it takes, because headache is always going to be very same. The only thing that might be different is the management of a headache. Right? Maybe the first line and second line might be different. Now, for management aspect, then I would recommend you to go to guidelines, go to RCH, RAC GP website and check for the new changes in management. Even then, let me tell you, not many of them have changed. Okay, very, very subtle changes. Recent biggest changes would be gout that changed in 2023 and 2024 beginning, gout changed. Asthma guidelines changed a little bit last year, I think in October or September. Shingles vaccines changed. Otherwise, pretty much everything has been similar. Okay, not too much of drastic changes that you have. So please use the handbook. And yeah, AAA, that this duration also changed for you. So even the management, they're all very similar. And the only thing I would say is that now in 2026, because AI and technology is a little bit more, you yourself can input your knowledge into these stations. So for example, in a migraine counseling case, let's say, in those days, we have a migraine diary where, like, oh, when you feel pain, you need to bring the paper, you need to go write down when you get a headache and all of that. But now you're in 2026, life's a bit more cool. Then here you can mention about, oh, you can actually have an app. There's so many migraine apps out there. We just lock it in that you have a pain. You go take a break. When your migraine is over after resting, you come back and lock in about your migraine. Right? Even when it comes to type 1 diabetes mellitus or when it comes to type 2, now you have the continuous glucose monitoring. It recently came a couple of years ago and it's been amazing. Now it's Bluetooth driven as well. So those are things you might not find in the handbook because those are a bit newer changes in the world. So these are things you can value add in your stations. Okay, but red flags always remains the same. Now, in every station of the Deepak, you must understand when you look at the tips from examiner or I think the assessment criteria, you would realize that every station given to you is a station that can be handled by a final year student or intern level. Therefore, which means none of the stations will require you to actually run to your supervisor. To be very honest with you, none of them would require you to run to a supervisor. You should be able to manage every single one of them because they are designed at your level. All right, so if we keep running to our in fact, they have mentioned about running to supervisors in the tips from examiners. If you guys go and get a read in that, you'll realize that they would have said that you telling them that you keep running to them means you either do not know what to do, or you can say you want to involve your supervisor. You can do that, but you need to explain on when the supervisor comes in or senior level personnel comes in, what is going to happen. You still need to know how is the course of the management for this patient. Okay. I haven't really tapped too much on e-medicine, but I heard that it's been helpful. I haven't spent time, I haven't really gotten the time to dive into it. So when I do get the time, then perhaps you could share on e-medicine. Um, any other questions with regards to this resource? If not, I'll move on to the other one. Now, many of you might have used John Murtak for AMC 1. It is still a fantastic resource because John Murtak was one of the biggest and best GPs. He was also an examiner for AMC Clinicals until last year when he passed on. He's a very, very amazing person, actually. So please, if you haven't opened the book, it's a book filled with color. Okay, it's not a black and white book. Please don't worry. So it has colors, it has triads, it gives you investigations. Management is also in that book of John Murtak. It's a soft copy. You can go online and you can download it. Now, for physical examination, Telly O'Connor is fantastic. Telly O'Connor has 2 volumes, volume 1, volume 2. Now, this book filled with color as well, filled with techniques. As I mentioned earlier on, it is done by an Australian doctor. So Australian doctors have written this book. So very similar. Geeky Medics is another one that helps with showing you how the techniques are done. So the thing about this is Telly O'Connor and Geeky Medics, these are all just showing you on how the structure is, how the accuracy is. However, there has been not yet a proper resource to show on how commentary is done in an exam. That really boils down to you and how you handle OSCE exams. Because during physical examination stations, you are required to talk to the patient. You are required to also communicate to the examiner at the same time. So that is a skill which counts as practice. But I would say for PE, please work on knowing accuracy first. Please work on knowing your structure. Once you have polished and solidified those, then you can move on to practicing a little bit more with regards to how do I do a commentary now and how do I include communicating with the patient in this. Sounds good for physical exam. So Geeky Medics, and this one is fantastic. How many times do you have to go through the handbook? Well, going through it once is actually enough. But when you do it that once, it has to be quality. Right? So it doesn't matter if you spend 1 hour or 2 hours on one station, because now you are reading that entire case. You're looking like, let's go back to the headache case for very quickly before I wrap it off. Let me go back to the headache case for a bit. So for example, we're looking at this case. You're just not revising this case, right? You're looking at the station, you're doing it. So which means get a role play partner with yourself for you, and you read the condition, get them to read how the exam is done, right? Because this patient will now be taught on how to act with you. So get them to read the performance guidelines, you will read the case, and then you will role play the case. See what you're missing. Well, it doesn't stop there, because now when you finish this case, it should be, what are all the differentials for headache, right? And for every differential, what are all the key points for it? And then you go and write for all these key points, what is the management? If I'm going to do a physical examination for headache, what would I do? So this, for someone who's very new to AMC Clinicals, this might take you up to half a day. But you know that you are doing a very quality learning and you've understood everything about a headache, including the critical errors and key points. If you do a learning like that, once is enough. However, if you're just reading and scheming through, maybe twice might work. But you definitely have to at least practice a couple of cases in the AMC handbook, not just read. And a lot of times I've said this exam is a talking exam. Things always make sense in our head. Everything's like, oh yeah, I remember. But then when we start role playing, when we start communicating and practicing, there's always this little circuit error that happens. So you need to role play and practice as well. And of course, quality over quantity. It's not about sitting 8 hours and role playing. It's about doing quality role play and learning from them and reflecting from them before you move on to your next role play. If not, if we keep role playing non-stop, we are just perfecting our mistakes. And that's not something that we should be working on. We should be working on changing our mistakes and getting it right. Sounds good? Sounds very stressful, I know. Okay, I know tomorrow is the booking day. Everything sounds very stressful as of now. So take it easy. Let's just try to nail a date tomorrow for majority of us. And once we get a date, then you can slowly relook at your resources and the time plan. I know a couple of you asked me for how you should manage your duration and your timeline for this. Now, if you're a second time sitting doctor, right, which means you've done this once before, your gap is very short between your first attempt and second attempt, I would say 7 weeks to 8 weeks of pure preparation is minimum 7 to 8 weeks is enough if you've done this before. If you are brand new and you are starting from scratch, you would need about 12 to 15 weeks of preparation. So include that 12 and 15 weeks. Start calculating it from the 17th of February or 23rd of February when you would have gotten a date. So from 17th of February, if you calculate 12 weeks or let's say 10 weeks, see where you led. If you've already started preparation, then I think it should be okay. You can go for any date that makes you comfortable. Any questions you guys might have? All right, so as I was talking about just now, so MedExam Expert is having a recall workshop, a 2 weeks recall workshop starting from the 26th of February. So if you guys are interested, yes, you guys can, there's a, one of the admins will send you the link to contact them, and then you guys can sign up for this workshop. If not, any other questions that you guys might have? Oh, yes. Yes, Deepak, I saw your question. If you're not able to finish one task of a station, if you're not able to finish one task of the station, you have to actually try your best to move on. There will be times where the examiner will prompt you to move along and go ahead to the next task. So please follow the prompt timer. If you do not address the task within the given time, unfortunately, a 0 means you might not clear. You will not pass the station actually. Yeah, you will get a 0 in the domain assessment area and you'll be an overall fail in that particular station. Okay. Dr. Ali, I just did the entire session on how to book the exam. Okay. Dr. Lubna, ideal time to start role playing? Well, as I just mentioned, if you're brand new, 12 to 15 weeks, revise first, get the content. Don't immediately start running to role play. Get the content in first a little bit for a couple of weeks, and then start role playing about 3 to 4 weeks later once you have enough content. Okay, but if in the beginning, if you want to role play once a week, I think that's good enough just to see how quickly you can remember where do you stand or what changes you want to make. But do not do intense role play at the beginning. You must understand your body needs to cooperate with you in this exam as well. So you need to rest. You need to not to burn out. A lot of doctors end up burning out because they do intense, thorough role plays, and then before the exam, like, love, I'm so tired. It happens. It even happened to me as well. I remember I lost my voice before my exam, and I was on high dose steroids. So these are not things that I want you guys to go through. So please take care of your health as well, right? Any other questions before we wrap off? In the meantime, for self-study and practice, record yourselves. So record yourself doing PFE 90 seconds, read the handbook, see the critical errors, or just verbalize things out of your mouth and to see that, oh, can I remember this? So you have to verbalize things because it's a talking exam. Therefore, even if you are alone, look in the mirror and just communicate. So get a point. I'm going to explain to my patient in 1 minute what is an aortic abdominal triple A. I'm going to explain a triple A to my patient. So start your timer 1 or 2 minutes. Now look it in the mirror and then explain what triple A is and record yourself in the meantime. And then go, okay, now I'm going to explain what is type 1 DM. And then you do that to your patient. Okay, so this might help you a little bit in your stations to self practice. If not, any other questions? If not, we'll call it a day. And all the best for tomorrow. I really, really hope you guys get a date and your preferences. Yeah, 12 to 15 weeks is enough. Of course, 12 to 15 weeks, I mean, if you are not working and you have full time, you're able to study. Okay. If you're working and all of that, maybe a slightly longer timeline might be necessary in how much you can dedicate. Any other questions? Dr. Ali, I'll show you the slides for that. Okay, you should have received the email for it, so you can take a look at the slides. So tomorrow you'll one more recap. So tomorrow you'll be able to book your preferences, book up to 3 preferences, then click submit. Once you do that, you should receive an email. Once you receive that email, be patient, and then you would get your selected date a couple of days later, make your payment. Okay, so go to your dashboard, go to clinical examinations, and then you should be able to get your date done. Oh, do after every 1 chapter. Not there's too much to hold, too much to do. And make sure that you're learning and making changes as you are doing. All right, all the very best, guys. See you guys around. Unfortunately, Dr. Puneet, there's nothing you can do, which is why preferences become a thing, right? So you hope that you're fast and you have not have too many people in your preferences. Okay, thank you, everybody. You're welcome. Oh, thank you.